pressure. It's a simple device. This device right here is nothing but a compressor. Air comes into the device, it pressurizes it to 5 centimeters of water pressure. The pressure travels to the tubing, all the way to this tubing, and it comes to the patient. It comes through a CPAP nasal cannula, and now allows the pressure to go through the nose, through the airway, and eventually arrives to the lungs. This is providing pressure. It allows the airways to open, the air sacs, or the alveoli, that may be collapsed from pneumonia, from premature lungs, or other causes of difficulty breathing. It opens up those air sacs, and now allows the patient to breathe easier and to breathe slower.
So is this a new technology?
So the physiology of CPAP has been used since the 1970s. This is not a new technology or a new principle. Originally described at Columbia University for use of premature babies that were suffering from respiratory distress syndrome secondary to lack of surfactant and premature lungs. So this device has been around for literally 40 years.
So why has it not been used in countries like Kenya?
And this is a great question. Why has CPAP not been used in these countries? It makes sense that it should be for a few reasons. CPAP is good for children suffering from pneumonia, children having difficulty breathing from other causes of viral or bacterial infection to the lungs, and it works very well for newborn babies that have difficulty breathing because of lack of surfactant. As in any medical device or any intervention in low and middle income countries, there are several barriers. The first and obvious can be cost. How much does equipment cost? Who pays for it when it breaks? Who repairs it? Who keeps it clean? This machine runs off electricity, so you need infrastructure. You need to have a continuous supply of electricity for this device to work. Also, how do you maintain people that are trained on the device? Some settings, there's very high turnover rate. You may train a cadre of instructors or users. They transfer to another hospital or another institution, and that other place no longer has trainers or users to have it. People have tried to introduce CPAP in other sub-Saharan African countries. There's been intermittent success stories in 1 or 2 hospitals, but it has not been scaled up to a larger level. This is because we need to take a more systematic approach, a systems approach, so we integrate it to the existing system, we train local trainers to train other people, and we sure there's a way to sustain equipment, sustain user, and sustain knowledge of how to use CPAP safely and effectively.
So do you think this is going to be important for Kenya, basing on, what you've seen in maybe other African countries where this has been used?
Right. We have done clinical trials in West Africa, in Ghana specifically, where we demonstrated that children who got CPAP, compared to those who did not get CPAP, it improved their respiratory rate by 16 breaths per minute after 1 hour of CPAP. That study demonstrated that in a lower middle income country, nurses can safely apply CPAP. Children with acute respiratory distress rapidly improved with the use of CPAP compared to standard therapy. And the potential for CPAP on a global scale is quite large. Remember, pneumonia is one of the leading causes of death in children throughout the world. Every 45 seconds, a child dies somewhere in the world from pneumonia. Pneumonia kills more people than malaria, HIV, and tuberculosis combined in children under 5. Kenya is no different. 18% of deaths in children under 5 in Kenya are secondary to pneumonia. Another 11% of children die secondary to prematurity, which that can be secondary causing respiratory distress syndrome because of lack of surfactant. The CPAP may also benefit those children right here in Kenya. Kenya is a great country for introduction